Researchers, they are trialling a new treatment method in the US. It's designed to help people suffering from lung and pancreatic cancer. It combines existing treatments with a targeted therapy designed to help a patient's individual needs. And I had the great honour to speak to Professor Philip Salem. Professor Salem, thank you so much for your time. Now, you've had over 50 years' experience in cancer medicine research. You describe this new treatment method as a breakthrough. Tell us how it works.
What I describe is a new approach to cancer therapy. I believe that the most important development in cancer medicine in the last 4 to 5 years has been immunotherapy. And there has been many trials, clinical trials with the immunotherapy plus chemotherapy, specifically in lung cancer. We came with a new concept of combining immunotherapy with chemo and in addition with targeted therapy. Targeted therapy is when you delineate a genetic mutation in the tumor, you target that genetic mutation. It is a drug that targets the cancer cell and destroys it without harming the normal cell. So we combine these three approaches to attack the cancer cell from different angles. And we were very happily surprised with the results because of the patients we treated, and they were all advanced refractory cancer that most cancer doctors may not even wish to treat. They were the patients who had the worst prognosis. And in spite of that, we were able to achieve something like 60% complete remission rate, something unheard of before this combination of the three approaches. We had 4 patients who were considered terminal by the best cancer centers in America. And these patients were thought to be hopeless, and no additional therapy was recommended by these cancer centers. When we treated them with this combination, 3 of the 4 achieved a complete remission. So there's something special about this combination. And we believe that this is a big step forward in the treatment of cancer.
Professor, you're still waiting for final approval for this method. Is there a time frame?
Yes, at this point in time, all the medications that we use, whether it is immunotherapy or chemo or targeted treatment, they are all FDA approved as individual medications. The combination of these medications together is not yet approved by the FDA. But with more trials confirming our results, I have little doubt that the FDA will approve it.
Professor Salem, you have also written a few books in your spare time, including one, Defeating Cancer, Knowledge Alone is Not Enough. Tell us about that.
I wanted to write a book where I speak about the lessons I have learned in these 50 years. And the biggest lesson I learned is that in cancer medicine, knowledge alone is not enough. The cancer patients need more than knowledge. Need love, need compassion, need caring. He needs to have a doctor who's ready to sit down and talk to him almost daily and to give him hope and to educate him about this disease and about the treatment.
You have worked at the White House. Can you tell us who you treated and your experience there?
When George Bush, the father, came to power, he brought a friend of mine, Dr. Bert Lee, as the czar of healthcare in America and as his personal physician. So Bert Lee appointed me to an advisory committee to the president on healthcare. So I worked with President Bush, and I also worked for 2 years with President Bill Clinton. And that was really very educational for me. I learned about the interface between politics and medicine.
Professor Philip Salem, thank you so
very
much for your time and expertise on Sky News. It's been an absolute pleasure and honour to interview today.
Thank you.
An extraordinary career where he's worked with presidents of the United States. Now, coming up on Weekend Edition, we'll continue our